As the body ages, one of the most noticeable and frequently discussed changes is the gradual shift in hormone levels. Declines in DHEA, estrogen, testosterone, thyroid hormones, and growth hormone are widely regarded as natural hallmarks of aging, often accepted as unavoidable consequences of biological time. Yet this interpretation may obscure a deeper and more correctable reality: that many of these so-called age-related hormonal changes are not programmed into our genes, but rather emerge from persistent nutrient insufficiencies. Hormone synthesis and regulation are highly sensitive to the availability of specific micronutrients and metabolic precursors. When these building blocks are chronically lacking, endocrine function deteriorates, not because of an inescapable biological script, but because the body's hormone-producing machinery no longer has what it needs to do its job. This insight dramatically reframes the narrative. Aging-related hormonal decline is not fate, but a correctable form of long-term nutritional neglect. Take, for example, the production of thyroid hormones, which govern metabolic rate, energy balance, and temperature regulation. These hormones depend critically on iodine and selenium, two minerals that are often deficient even in industrialized countries. Iodine is required for the synthesis of thyroxine, T4, and triiodothyronine, T3, while selenium supports the deiodinase enzymes that convert T4 into its more active T3 form. Without enough of these nutrients, thyroid output decreases and conversion efficiency falters, leading to symptoms that mirror what many think of as normal aging: fatigue, weight gain, cognitive slowing, and sensitivity to cold. But these are not inevitable. They are correctable symptoms of biochemical insufficiency. Similarly, the body's ability to produce steroid hormones like DHEA, testosterone, and estrogen relies on cholesterol as a precursor and a host of vitamins and minerals: zinc, magnesium, vitamin B5, and vitamin C, to name a few. Zinc, in particular, is critical for the enzymatic steps involved in androgen synthesis and function. Vitamin B5, pantothenic acid, is essential for the production of coenzyme A, which facilitates the conversion of cholesterol into pregnenolone, the precursor to all major steroid hormones. Vitamin C plays a key role in adrenal hormone synthesis, supporting cortisol and aldosterone regulation. If any of these nutrients are deficient, especially over time, hormone production can falter, not because the glands are failing due to age, but because they are being asked to perform without the necessary substrates. The decline in DHEA levels often seen in older adults is a case in point. DHEA is a master hormone that influences immune health, stress resilience, libido, and cognitive vitality. Its gradual reduction is often interpreted as inevitable, but studies show that nutritional status directly influences adrenal output. Low levels of key nutrients, combined with chronic stress and inflammation, impair the adrenal cortex's ability to produce DHEA. This adrenal fatigue is not a myth, but neither is it an unsolvable riddle. It reflects a mismatch between demand and supply, where the endocrine system is trying to adapt to pressure without adequate nutritional and biochemical support. Sex hormones also follow this pattern. While a decline in estrogen and testosterone is common with age, the severity and speed of this decline vary widely between individuals and populations. This variability again points to modifiable environmental inputs rather than fixed genetic fate. Populations with diets rich in zinc, vitamin D, healthy fats, and phytonutrients often retain better hormonal balance into later decades. On the other hand, long-term deficits, whether from restrictive diets, poor absorption, or increased physiological demand, deplete the body's ability to keep hormone levels within a healthy range. The result is not just decreased libido or fertility, but a weakening of the regenerative and protective systems that hormones help regulate, from bone density to mood to cardiovascular health. By understanding hormonal imbalance in aging as the outcome of nutrient depletion, we shift from a view of hormonal collapse to one of hormonal insufficiency, an insufficiency that can often be corrected or improved. Hormone replacement therapy has its place, but it should be seen as a secondary option, not the first line of defense. Before replacing hormones externally, we must ask whether the body has what it needs to produce them internally. Restoring zinc, selenium, iodine, vitamin D, and essential fatty acids can reignite the endocrine system's natural rhythm. Supporting the adrenal glands through B vitamins, magnesium, and adaptogenic herbs can enhance resilience without pharmacological suppression. Reframing age-related hormonal decline as a nutritional failure is not just semantically important, it has practical and ethical consequences. It empowers individuals to take control of their health with strategies rooted in restoration rather than resignation. It encourages practitioners to investigate root causes rather than treat symptoms. And it paints a more hopeful picture of aging, one in which the body remains capable, responsive, and adaptive, given the right support. Ultimately, hormones are not passive victims of age. They are dynamic signals shaped by the biochemical environment in which they operate. When that environment is well-nourished, the endocrine system functions with clarity and balance, even in later life. Aging, then, is not the withdrawal of vitality, but the body's request for deeper support. And that request, once acknowledged, can be answered, not with synthetic overrides, but with the intelligent repletion of the raw materials life has always depended on.